So what I always do when I first meet patients, when they come to me, is I want to see, actually, is this reflux disease? I listen carefully. We take a very detailed history. And then we do investigations which usually involve endoscopy, measuring also the pressure within the esophagus using something called manometry, and measuring the amount of acid in the esophagus. In the development of a hiatus hernia, the upper stomach migrates up into the chest cavity. It's not something that will correct itself. Once the little bit of stomach's gone up, the effectiveness of that sphincter, that lower esophageal sphincter, is diminished. Pressure within the chest is negative, the pressure within the abdomen is positive. So once you get a little bit of stomach in the chest, it's almost intuitive. The stomach will, the contents of the stomach, the liquid in the stomach will go up there. It will wash through the esophagus, sometimes explosively, going right up to the pharyngeal level and then beyond. The ones I really worry about are the ones which affect your voice, where you get hoarseness, throat clearing, a weak voice, you can't project your voice, or waking up nighttime coughing. That worries me a lot. Nocturnal aspiration, people coming out with chest symptoms, asthma, recurrent bouts of pneumonia. By the time you've got to that stage, you really need a fix. We have three options to reinforce the sphincter. We do what's called a fundoplication, where we stitch the stomach and create a little bit of a buttress, a little bit of a valve or a wrap around the lower esophagus at the junction. The other option, which I've been doing, is the links. And this is a little magnetic device, titanium with magnets inside. It's almost a bracelet that fits around the esophagus. And the results of that have been very good, and patients have been generally very, very happy with it. And another device that has just come online is the reflux stop. The reflux stop is effectively just an enhancement of this plication that you're doing. It makes it more robust, more durable, and it also plays a major role in keeping the lower esophagus within the abdomen so that the hernia does not come back, so it doesn't migrate back up. This is particularly useful for those patients who just haven't got the power in the esophagus to push the food through. And if they haven't got the power, you can't put a fundoplication there, you can't put a links there. But with the reflux stop, you can fashion a fundoplication that doesn't give them difficulty in swallowing. And we're now offering it to our patients who otherwise might not be candidates for surgery and would be effectively condemned to lifelong reflux and medical treatment. So we're restoring the esophagus to its natural environment. We allow people to come off medication, which allows the stomach to digest the food as it should be without switching off the acid. In the short term, that allows healing, and in the long term, allows normal esophageal health, and hopefully prevents damage to the lungs and the vocal cords as well. So multiple benefits.